Dr. Chau again here. We'll go for a few things about what you should know for preparation for your post-op care. Now I'd like to go over some of these instructions for after surgery for a brow lift. Typically, brow lift come into two versions. Either we do it with a endoscopic brow lift or a open brow lift. If you have a open brow lift or even a endoscopic brow lift, you would expect to wake up and with a bandage around your head, which is something that it's important for you to keep it on to reduce swelling and reduce bleeding. Expect to have some bruising around your eyes area and swelling. And if you have that procedure performed in conjunction with blepharoplasty, you expect to have your eyes a significant amount of swelling, sometimes even have difficulty opening your eyes for the first 24 hours. When you wash your hair within the first 24-48 hours, expect to see some loose hair falling out. And that's not because your hair is falling out, it's because when we do the procedure, we may trim a few areas so the hair come out is because of a trimming. We place the incision and we place the suture in the area where we really hide your scar. So the only thing really have to do is you take a shower and wash your hair like you would normally do. You will comb them with a wide tube comb and then you blow dry them. And essentially, it's a very simple post-operative care. It's just that put ice around your eyes because of the swelling. Other than that, you come to see us once a week for the first 2 weeks and to monitor your healing. If you have temperature of 101 or higher, or you have excessive drainage for 48 hours or vomiting, please give us a call. We can help you with that. There's something called DVT, which is the development of blood clot in your deep vein of your lower extremity. And we usually try to avoid that by having you get up early and walk around. Do not just lay in bed. Of course, most of these prevention are also being done while you're asleep in the hospital during surgery. And part of the hallmark of DVT is swelling of one extremity more than the other, and this is something bring to our attention. Now, if you experience any nausea after surgery, which is normal, try not to eat too much solid food. Maybe start liquid food, and then you eventually slowly advancing to a regular diet. Now, in terms of taking medication, you are pretty much feel free to resume all the medication you take prior to surgery the next day after the surgery. Basically, unless there's specifically instruction, we tell you, but you can resume your shower and your bathing habit after 24 hours after your surgery. Try not to lift anything heavier than 5 to 10 pounds after surgery, or avoid any strenuous exercise or lifting weight. Now, if you have a dressing, do not remove them until we tell you to do so. And we also provide you a written instruction for the procedure for your review at your pleasure.